Good morning, everyone. So today I'm going to discuss some of the sessions I have with African Americans in Sacramento. And I chose to do that considering the health inequity they suffer. And some of the reasons for that is their low socioeconomic status, and then inequity in education, and then inadequate access to health, and behavioral health factors. So behavioral health factors is my major consideration. And I chose to do that based on the associated increased risk of chronic diseases, ranging from heart diseases to cancers to diabetes and the rest. And the consequences is lower life expectancy and then preventable deaths. So I had to meet them at their different locations, in social events, in schools, religious gatherings, social media, and then probably in future, even through the consultation rooms. So the four areas I considered I chose to look into is avoidance and reduction of alcohol consumption, smoking, healthy diet, and exercise. My reason for choosing avoidance or reduction of alcohol consumption is because of the associated health loss. It's also known to constitute a lot of burden to global health, and then the cancers and all cancers mortality. And it's also been said or shown that only low consumption of alcohol can take away some of these associated diseases. I had to make them to understand that taking of alcohol will increase the risk of obesity, ulcers, and a lot of diseases, including heart diseases and cerebrovascular accidents. And then pregnant women who take alcohol could also have babies that will be have some complications, especially when those drinks are taken early pregnancies, what is called the fetal alcohol syndrome. The consumption of alcohol can also lead to blood clots, and then when people take methanol, it could lead to medical emergencies and even death. And then when they suffer for a lot of hangovers and absence from work or some tardiness in the work area, they could lose job. And the cycle of poverty and low socioeconomic status continues, as well as lack of access to healthcare. So the practical suggestions I discuss in some of those gatherings is they need to start early talking about it. Like myself, I don't take alcohol because I picked that up from my family. No one takes alcohol in my family, and I grew up being told of the consequences of taking alcohol. And so my parents were good examples. And then when you tag along with people who don't take alcohol, it has a ripple effect. You get the motivation not to do that. And then the issue of stocking alcohol in the house, some people don't take alcohol, but they stock alcohol to serve to visitors. By so doing, the person might be tempted to take, especially those who have taken in the past, and even the kids might also have access to this alcohol. And then when people are not busy, idle brains have increased risk of trying to get some things like alcohol or even drugs. And then we should also look at the peer pressure, which is more on the kids, adolescents, where they want to do what their friends are doing. And then by so doing, they can take alcohol. For those who take alcohol, my discussion with them is to stop or decrease, even though it is in a gradual fashion. They should set a drinking goal, reducing the quantity gradually until they get out of the wood. And then the Alcoholic Anonymous was also discussed, where they could have non-judgmental environment and follow the steps, the 12 traditional steps that has eventually helped a lot of people to go off drinking. Then my second, this is actually a kind of brief of what they are. There are 4 major areas. I'm only giving a kind of summary of what each of them are or is. Then the second aspect is issue of smoking. I also chose smoking because of the public health burden associated with it and the diseases also that has the risk increase. It's been said that about 5 million people die every year from complications of disease associated with smoking. And by 2030, that could reach to 10 million deaths globally. Just like alcohol too, diseases, smoking causes a lot of diseases in the body, from central nervous system to virtually almost all the systems, the heart, the lungs, diabetes, and cancers. Some of the cancers include cancers of the throat, the voice, the lungs, and even the pancreas and the cervix. The suggestions I discussed with them is also to start early, because when people get some virtues early in life, it will be more difficult to throw them away. And then to avoid negative influence, whereby people go tag along with others who smoke and probably could encourage them to do that. People have also said so many reasons why they smoke. Which one of them is stress. So anyone that passes stress should find a way of trying to manage it, probably seek advice of the psychologist or stress loss managers. And then exercises can also help to distract people, yoga and all the rest. So when the pressure comes, someone can go and walk or do some of those exercises. And then the motivation is very important from family and friends who will encourage someone who smokes to reduce or to get rid of it. And then the triggers like going where people smoke or tagging along where they chew tobacco or do any of such, avoiding that can go a long way. Then the role of nicotine replacement therapy, which can come in inhalers or patches or tablets, can also be used. And then there's been this advocate for smokeless tobacco. And then just like alcohol too, there is something about Nicotine Anonymous where they can also get some help and eventually pull out of smoking. A lot of people do not have some of this information from my experience. Like last week, I attended a quarterly meeting of Nigerian people in Sacramento. I discussed smoking cessation, and I'm glad that a lot of them got some information to manage things like that. Then the third item I discussed is diet. And healthy diets is when people choose food types that can help to prevent onset of chronic diseases. A typical example of such diet is Mediterranean diet, which has more of plant-based constituents and low in terms of animal constituents. My plate describe what could constitute a healthy diet, whereby the foods, grains and vegetables constitutes about 60%, 30% each, and then fruits and protein, 20%, and then they need to take dairy, although some type of diet might not go that way. Then the healthy eating plate is another example, which is closely similar to my plate, but this suggests that people should take a lot of water. And then if they have to take oils, it should be heavy oils like olive oil. And this is just another picture of what people can eat each day. So people were encouraged to choose what they are comfortable with, what they can afford, but to make sure it flows in this way to have proportions that contain each of vegetable, fruits, proteins. And then we discuss some of the ways people can eat healthy, which we talked about to avoid large portion sizes, which means people can choose to eat little at a time. And then some tips is to avoid, as much as possible, you can cook at homemade foods, avoid some of these junk foods in the restaurant all the time. And then to also encourage them by explaining what they stand to benefit from eating healthy, which includes reduction of the risk of developing some cancers, cardiovascular diseases, so overweight and obesity, and then some neurodegenerative diseases, even Alzheimer's, depression, chronic obstructive airway diseases, and then osteoporosis. Again, some cancers, like I said, cancers of the lungs and the stomach and the rest, heart diseases will be reduced when people eat healthy, especially adopting the plant-based diets. Then the last one is physical activities, which is actually when there's a movement, a body movement, where the skeletal muscles use and that energy must be spent. That means that sitting one place and probably rolling around or something cannot be considered as physical activities. Energy must be spent. We talked about 4 types of it, endurance to cardio to strength and balance, flexibility, 5 types actually. And the thing there is to ensure that one makes a combination of these types of exercises to actually derive the maximum benefit from exercises. And then there should be about 90 minutes exercise every week, according to guidelines, physical activity guidelines for Americans. Moderate aerobic exercises of about 150 minutes or 2 days muscle strengthening activities. The moderate exercises are things like walking hard or hard enough that can increase one's heartbeat. It can also allow someone to talk, but you may not be able to sing or something that make you do less than 10 miles per hour if someone is cycling. Then to also motivate people to do that, we discuss what they tend to benefit when they ensure that they are always engaged in exercises. We talked about the reduction in the risk of chronic diseases like hypertension, overweight, and obesity, as well as Alzheimer's diseases and hypercholesterolemia. Depression and anxiety are also lower in people who always engage in exercises. And then exercises can also help to elevate moods because it's been shown to help in the release of the feel-good hormones that is called endorphin. It also enhances appetite for people who have problem eating for whatever reason. When they engage in exercise, especially in the morning, they could be able to eat more. And then also it comes as therapy for sleep, especially when the exercises was done in the morning. Some people have talked about so many reasons why they can't do exercise. We discussed all of them. Some say they don't have enough time due to work, or they don't have interests or no motivation. So we talked about building in the exercise even in your work. You could tend to do some 5 to 10 minutes before you start your work. You could engage in jobs that make you to move around, walk around a lot. And then also have friends who have interests in exercises that could encourage you to do that. Then by so doing, you get the amount of exercise you need in a week. There's issue of some say they have kids and all that, they travel a lot. So we discussed that you could share the babysitting or looking after your kids with your friends or neighbors, so they could have time for exercises. Or you could also even do the exercises with kids. There are some exercises that kids participate in. You can also initiate those ones. The kids will involve in exercise, and as well as you. When you travel, make sure you lodge in hotels that have facilities for exercises, so that you can make use of it either in the morning or in the evenings. And then you can actually register in some other organizations that will allow you to do exercises even when you move from city to city. So the issue there, the key point there is that they all were made to understand that exercise play a role in healthy living and helps to prevent and even manage chronic diseases. And that's important why everyone should be interested in exercises. So thank you for listening. These are some of the references I used for the presentation. Thank you.
Okay. Any questions at this point for Innocent? I forgot to introduce him. Maybe some of you don't know. Dr. Durugbo is a medical doctor in Nigeria. I don't know if you are working with your license here already, but he is one of our students in preventive care. And then he was just approved of his proposal for the final project, working also with African Americans in the community of Sacramento, Central California. Are you working with your medical license here or not yet?
Not yet.
Not yet, okay.
Yeah.
Sorry to mention that, but
no
it's
problem.
a family here. It's a family. So maybe you can stop sharing the screen and then we can talk to more freely. Okay, any questions for Dr. Durugbo? Well, I will ask a question. Did you find any barriers to communicate this with your audience?
I didn't have any much problem because I actually went to fixed meetings, and I discussed with the organizers of the meeting, and they were able to map out 15 minutes for me to talk to them. I didn't actually discuss all the 4 issues with them because of lack of time. So the last outing I went last week, Saturday, was I discussed alcohol consumption, reduction of alcohol consumption and smoking. So it was association Nigerians in Sacramento. I didn't have any problem in communicating with them.
Great. I don't know if alcohol is a big issue. I remember one time I was working with the Portuguese in California, and then among the Portuguese, alcohol is almost Portugal is one of the countries in Europe that drink more alcohol than anybody else. And then it was not easy. I remember I was making a presentation. We had a TV channel in Artesia, and then after the program, they would be drinking wine with friends there, and it was not easy to address that issue. It's sometimes the culture is so strong that we have to overcome those barriers. But good, yeah.
Nigerians drink a lot of alcohol for so many reasons. They tend to agree that it's associated with some health problems. I think what's important is to keep on talking about it, because when some of these things are not discussed, people may tend to forget. So that's why such things are important for them to be hearing them once in a while.
Thank you very much. Now we are going to pass the time to Jonquile. Jonquile, feel free to prepare yourself. I think I already allow you to share your screen, and then you can go there.
Okay, good afternoon, everyone. Let me get my screen together here. Just pull that up. So just as kind of some background, my applied practice was on with the Loma Linda University Center for Health Promotion Intensive Therapeutic Lifestyle Change Program. Let me share that here. Okay, great. Share. And I'll hide the thumbnails. Okay. Can everyone see that? Okay, perfect.
Yeah, perfect.
Thank you. So as I mentioned, I was with the Intensive Therapeutic Lifestyle Change Program here at Loma Linda. It's kind of a unique program that it's with the university, a program that is hoping to combat chronic disease, so preventing and mitigate that among the population and in our community, as well as integrating in health coaching as a support system to help individuals navigate. So as the public health issue, as we all know, chronic disease in America is prevalent. As noted here from the CDC, 6 in 10 adults in the US have a chronic disease, with 4 in 10 having 2 or more of those diseases. As we know, chronic disease can lead to disability and just a poor quality of life. And it's costing our country trillions of dollars, as noted here. Those chronic diseases, as we know, can be found as heart disease, stroke, diabetes, and so on. So for our project, as I mentioned, with this applied practice, I worked as a health coach in the ITLC program. As I'll detail later on, I had about 4 participants that I worked with, and I spoke with them weekly. So basically supporting them on their journey to improve lifestyle behavior change. With the ITLC, again, the purpose is, the aim is intensive and total emergent strategies. It's a comprehensive approach that engages these patients or participants for 8 weeks. They have 10 group sessions on Zoom, via Zoom, and those are weekly. ITLC allows the participants to play an active role in their behavior change. They get to set the pace of how their behavior will change, and with our support and with the Health 180 meetings and group sessions, that will hopefully engage and educate them about how they can empower themselves towards improved lifestyle change. Right, so here, as mentioned, this is taking place at Loma Linda. That's where I had my applied practice. I worked with the Department of Preventive Med, Dr. Kramer specifically, and just getting to know about the ITLC program, getting kind of the gist of how things flow with the program, and then engaging with the patients one-on-one. As I mentioned again, it's 10 sessions over 8 weeks, and the sessions are 90 minutes during the Zoom sessions. And then we do have the 10-minute breakout sessions where I, as the health coach, would lead, I guess, the discussion for the night, inquiring if they had any questions about the topics that were covered, or if they wanted to, kind of share with each other their experience so far throughout the lifestyle program. The population consisted of men and women from 35 to 75 years old, and the kind of, I guess, eligibility or how they recruit these individuals is they should have at least one chronic disease to join the program. So here, with the ITLC program, these individuals do go through a few health assessments. They work with primary care physicians. They're in the lifestyle clinic. They get baseline information collected, like their biometrics and some labs done for them, so they can have that at baseline and then compare again after the program. They have a couple meetings with the physicians throughout the extent of the program, which is beneficial, so they can just see how they're progressing physically, and can then, with health coaching, adjust depending on what their results are. And we can discuss those. I've discussed it many times with participants during their individual sessions about, what do you think, how do you feel about your results that you got back from your testing, your lab findings, or your biometrics? And then how do you feel like you can change your trajectory to better improve, or what steps can we take as far as nutrition or health, and set up kind of an action plan and set those goals. A little bit about the ITLC curriculum. So it promotes participant sustainable multifactorial lifestyle change through comprehensive approach using intensive and totally emergent strategies, as I mentioned. We like to engage the participants and maximize the contact hours with them. We have an interprofessional healthcare team that's supporting them. We have weekly group and individual sessions. We tried, as health coaches, we provide them with any resources that may be helpful, like, for example, Happy Cow, I think it's .net, where you can search for healthy vegan restaurants in your area, or we'll share with them nutrition label facts from the FDA and kind of work with them on what does that mean to you and what should you be looking for as you go shopping, weekly at the grocery store, and how to integrate those behaviors daily. We always try to have consistent follow-up and feedback. So anything we may discuss in health sessions, one-on-one, health coaching sessions one-on-one, or even in the group, we try to follow up with that participant and address any needs or questions that they may have. So that way we always keep that feedback loop open and establish, trust and communication, which is very essential to the health coaching aspect of the program. The program also offers a 12-month follow-up with physicians after the ITLC program. So with that, the participants, on one hand, they can engage with health coaching even after the program, but they also have the opportunity to engage with physicians, still going for checkups and tracking their progress as they change their lifestyle behavior with nutrition, physical activity, and so on. One of the key Health 180 modules, that's what we call the presentations that we have during ITLC. One of the key things that they follow is the ACLM 6 pillars. So that includes your healthy eating, your physical activity, managing your stress, avoiding any risky substances, forming and maintaining relationships, and then improving your sleep. So with this within the program, they do support the whole food plant-based dietary pattern, and that aligns with the ACLM definition, where it includes a variety of minimally processed fruits and vegetables, whole grains, legumes, nuts, and seeds. And they believe that this will support a healthy nutrition lifestyle change. We also recommend improved physical activity, even if it's as minimal as 10 minutes during your day. We try to recommend that there are benefits towards moving. And in our Health 180 modules, we even have some of the residents or doctors at Loma Linda will do a short 6-minute group exercise session where they review helpful exercises they can use at different points. And then we also discuss the modifications for those who have like physical limitations. Another point is the community resilience model, CRM for stress management. We do have another health coach that is certified also with Loma Linda, and that is a separate session that is offered to the participants where they can discuss resiliency techniques about if they're dealing with stress or dealing with pain or dealing with, any of those things that may be an issue in their life. Another important topic for ITLC is spiritual health. We kind of group that in with the relationships and maintaining relationships and that social connectedness. So we try to, through the Health 180 modules, discuss points of either feeling shame or guilt or dealing with forgiveness, dealing with how you can connect to your, definition of spiritual and in your community. And so we feel that with all these pillars together, it helps to support the individual to making those associations between the points in their life that do influence their health behaviors. So for health coaching, as I explained, we do have group sessions during the Health 180 PowerPoint presentations. Those can be 10 to 15 minutes. They review the module topics, we address any questions, and we just want to build a community with the participants that we have in the room with us, among each other. In the individual sessions, I specifically had 4 participants, ages 45 to 60 years old. We typically had 30-minute weekly sessions. During these times, we would discuss how they can make better decisions for their lifestyle change. You'll see in the slides coming up what techniques I use with that. We tried to explore any perceived barriers. We discussed any positive shares that they had for that week, any challenges, any lessons that they may have learned, what goals would they like to make moving forward, and just really trying to dive into any points of interest for them and any questions that they may have. We also took, as health coaches, we take weekly notes, and those are available on the ITLC team's, group folder. Those are great just to refer back to after the meetings with the participants to kind of reflect on what resources they may need, what topics we can continue to address and align with so that they get the most out of these sessions. They're also helpful to just track what type of tools we're using and strategies. And as health coaches, we do connect with each other and try to streamline the entire process so that we're being as beneficial for the participants as possible. So as I mentioned in the health coaching sessions, some of the strategies that we use, one of them is TTM, of course. This is important when you're starting off the session with the individual. Usually I use this in the background portion of our meeting, usually the first session where I ask them, what are their goals? Why did they join the program? What motivates them? That kind of thing. What the idea is just trying to determine their stage of change. So that way I can effectively engage with them where they're at and determine what would be how to approach the situation, how to encourage them across this lifestyle journey. So as mentioned here with the slide, we want to identify the patient's stage of change and their readiness to develop those realistic goals. And again, realistic because this is a process. It's not something that happens overnight. And we try to emphasize that with the participants so that way it alleviates that pressure of I have to do this immediately or I have to switch to a vegetarian immediately. So we just try to emphasize that with them. We want to emphasize the flexibility and fluidity of the process that they're going through. We want to empower them and acknowledge their successes towards their improved motivation. So many times in the health coaching situation, participants may get discouraged, or maybe they don't see the successes along the way during their lifestyle change. And I always try to make a point to encourage that positive talk as a strategy to let them know that even the smallest of change they still count, and you can take joy in that and have that gratitude. We also support them in determining the appropriate engagement level. So with health coaches and the participants, sometimes, their schedule is busy, or the weekly sessions just don't go as planned. So you have to, continue to engage with them and reach out to them as possible. So sometimes you can do that if you have a telephone call, or if you have a Zoom session and maybe that's not working for them, or they get busy, you can switch that to even an email or a text to say, do you have any questions? Is there anything that you're missing or would like to discuss? And so you just keep that line of communication and encourage that feedback loop during the process. Again, we want to empower the participants towards their current strengths and resources and capacities. So whatever physical activity they're in right at the moment, or whatever nutrition goals they're going for, or the relationships that they have in their life, it's important to just continue to empower them and allow them kind of open up that mind's view of, you have the strengths and resources to pursue this change, this lifestyle change. And so during the health coaching sessions, that definitely came up a few times. Then we want to acknowledge the behavior change as a multi-step process. Again, this is something that is not going to happen overnight, and we try to reiterate that throughout the process so that we let them know this is, changes in small amounts, realistic amounts, and then you build consistency and sustainability after the program. That's definitely the goal. And again, we want to build a rapport with them that facilitates trust and collaboration. Most of the participants are very open and excited about this lifestyle change. So getting that rapport and building the trust comes pretty easily. They're very open and honest and excited about the changes that are to come. So motivational interviewing, of course, is a key tool that we use in the program and that I used as well. This helps to address any lifestyle behaviors, their perceived capacity, their attitudes, and their goals. We use it to address the correlations between physical wellness. It's also been used to improve mental and emotional wellness. And then, of course, to build skills towards self-care through efficient, engaging, and personalized collaborative communication. Motivational interviewing, you're using your open-ended questions, of course, and many times during the health coaching process, I leaned on this to just further engage with the participant to understand where they're coming from and to promote that autonomy-centered coaching. You want to make sure that they know that they're in control of this lifestyle change, and that you're not influencing them as far as you have to do this, you have to do this. It's more about asking them, where do they want to go with this? How do they envision their life moving forward? Here's a little picture of the wellness wheel. That was a great tool to just help them focus in on what part of your life do you feel like you need the most change or support in, and how can we help you get to that goal? Let me see. And again, with SMART goals, of course, we'll talk about that as well. SMART goals are really powerful with helping them to, envision the goals that they want to set and help them focus on even a short-term goal. Like many examples I have with my participants would include, all right, so we have a SMART goal that you would like to set. Let's start thinking about what that actually looks like. So the goal might be, I'll walk 20 minutes with my dog 3 times a week, just to start off the physical activity, because some participants, they're a bit older, and the idea is you don't want the intensity to be too extreme. So it's good to start off with walking and try to build on that consistency. And so as a SMART goal, we set that 20 minutes, 3 times a week with your dog. And then you start to discuss with them their action plan. How are you going to do this? Are you going to do this after work? Are you going to do this What are you going to do if it rains? Like we've been getting a lot of that. Just trying to map out what does that actually look like throughout your day? And if something comes up, how do you navigate that? So next is positive psychology. So as I mentioned with participants, that positive talk and trying to defeat those feelings of barriers or challenges that may come up. Positive psychology was definitely helpful to reinforce and empower the participants. As it says, it builds empowerment and self-worth by acknowledging any struggles experienced by the participant. So if they had a physical limitation, we've had participants with injuries, like with their knee, their shoulder, and we do a lot of strength resistance recommendations for physical activity. So this was beneficial to encourage them that you may not be able to do the full range of physical activity with, say, your shoulder or your knee with that particular workout, but you can do a modified range, and you can, instead of doing maybe 10 minutes with 4 reps, you can do 5 minutes with 2 reps, whatever kind of works for you in that way, but always maintaining that positivity of you're working up to the full range with that workout. So you can start small and work your way up. Next, it helped redirect the participants' narrative, helping them to acknowledge what is right and working to nurture positivity, resilience, and innovation. So again, whether it's with nutrition or physical activity or establishing or maintaining your relationships, we want to direct their narrative to just positive thoughts and that feeling of resiliency that maybe if your diet right now, you're still not eating enough fruits or vegetables, with time that will change. So maybe try including a fruit or vegetable as a snack every day, or try changing one meal a day to a majority of fruits and veg on the plate with maybe some fish. But, you know, just trying to encourage them that the changes are small, but you are, there are alternatives, and you don't have to feel stuck in the current place, but just make the small changes as you go. And then lastly, supporting participants with decision-making and acknowledging the possibility of challenges, but how to redefine pathways towards opportunities. Many times participants, just like all of us, we have a certain way of doing things. We have a certain way of maybe making checklists throughout our day, and we have to complete that checklist. And if we don't complete the checklist as we planned, we get discouraged. That has happened with participants where they go through this program, maybe their progress is slow, or maybe they feel like they're not making the changes they need, and they go take their labs as we, do the pre and post through the ITLC. They take their labs and they see that maybe their weight only changed 1 or 2 pounds, or maybe their BMI wasn't as different as they thought it would be. So looking at that, you want to then, through health coaching, support them and let them know that now's the time we can, again, make a decision and acknowledge that this is the challenge, but we can redefine the way that they're thinking moving forward so that that forgiveness aspect sets in with them and they're able to see this is not what I expected as my result, but moving forward, we can set up a plan to improve that. So with the outcomes for this program, outcomes and objectives and outcomes. For objectives, we wanted them to be able to identify long and short-term goals through self-determination and strategic thinking. So we support that with helping them set the goals and figure out where they even want to start and what is possible, and find that area to focus in on. With individualized, we help them with action steps that align with their culture, their beliefs, values, and customs. So with ITLC, we do have different people in the program. So you want to make sure that you're incorporating those. For example, one participant had a Hispanic background and she was used to eating a particular way. And so the idea was, how can we support your action steps towards improved nutrition while considering your culture and your household and your family that you're cooking for and the lifestyle change that you're making? So you always want to consider that. And as such, we were able to figure out alternatives during in different recipes, start looking for more of the beans, more of the veggies, and even leaning into trying tofu as a substitute. And so just considering that for our participants is important. Next, we look at commit to successful strategies that enhance success via vision plan and SMART goals framework. So that was definitely a key objective here in this applied practice. And as such, we used a lot of the tools, health coaching tools, like an actual vision plan or vision exercise where we asked them, where do you see yourself in 2 years, 5 years? What does that look like to you? What does your health look like? What are your relationships looking like? And just trying to actualize that the lifestyle changes can be beneficial and sustainable. So let's figure out what that looks like and commit to those changes every day. And then lastly, understand that each area of health and wellness is connected and plays a role in supporting their journey and lifestyle. And again, we reinforced that during the ITLC with the ACLM pillars that try to connect all of those aspects of their life: nutrition, physical activity, social connectedness, sleep, stress, etc. Just linking those together and showing the individuals that in every way, these are important. And when you put them all together and you create a plan where you can, strategize what healthy decisions am I making in each of these aspects, you just kind of see everything fall into place. So with the outcomes, kind of just going over that again, with different participants, we just related what happens at the end of the ITLC is we look at their participant feedback. So that's collected after the program or in the last few weeks of the program. So we look at the health coaching notes. In the group sessions, we ask them, how do you feel about the program and where do you see yourself going? We do that as a group so that everyone can discuss and kind of build that community of we're all on this journey and there are other people who are going through this. And we do that individually. So that way we can discuss with them, what does your life look like post-program, and think about your SMART goals and think about the challenges that may come and how you can decide to still support your healthy lifestyle changes. We ask them open-ended questions just to determine where they're at near and after the program to assess, how they're going to move forward. And of course, that information is helpful because it helps us to see if the intervention was successful at all, but then also helps the individual to see that they can continue exploring these avenues of life towards improved lifestyle change. Finally, with the ITLC program, I did also help them with modifying some of their Health 180 PowerPoints that we share with the participants, about nutrition, physical activity, stress, and so on. And so some of these are the ones that I edited that were related to, of course, the nutrition presentation that they had. So other than that, that sums up my presentation. I appreciate your time and your attention. And if you have any questions, I can take those now.
Thank you, Jonquile. This is really exciting because this is the work of preventive care. I mean, in practice, that's something that every single student should be, at least if they are thinking to go into the clinics, should be prepared, should be trained, should be expected to do. Let me ask a first question. In your experience, what would be the main barrier that you found among the participants? Would that be stress or money, financial, or cultural, or for them to move forward on their lifestyle change?
Mm-hmm. That's a great question. To be honest, it's as simple as the mental ability and feeling the capacity. So part of the health coaching is to address that, to address those points of where they don't feel like they can forgive themselves for still wanting a burger instead of being consistent with the increased fruits and vegetables in their diet, or they might feel guilty about, oh, I have to change the way that I'm eating, but my family, they're kind of slow going. So it's that capacity that honestly seems like the biggest challenge. Just helping them envision that these changes are small and that it's not going to happen overnight. And if you can at least put forth this much effort, that little bit of change can happen. And that way you can build your consistency. So yeah, honestly, it's just the capacity part of it and forgiveness, forgiving themselves.
Thank you. Any other questions?
I see Dr. Beeson and David Hunt.
David was first.
Okay. David, your question?
Hi, sorry about that. I'm at the hospital, so for the privacy of patient, I can't turn on the camera. But one question I had, you mentioned you did that through the hospital. Now, at this stage, you didn't need the IRB, or you still have to do that one because you're working with patient?
So this was the applied practice. I went through the Department of Preventive Med. And so that's with Dr. Kramer and Dr. Wilson. And they already had a whole IRB thing for potential research for this. And then my participation is kind of included in that. But there was no issues about, I guess, confidentiality. They have the program set up to where once you volunteer and you become involved, they kind of just take care of all that.
Okay, so if I work in the hospital, this is for every hospital, or just because it's in Loma Linda affiliate is easy to do that?
Loma Linda affiliated, I'm guessing.
Okay, I was just wondering. Thanks.
No problem.
I guess Dr. DeSantis has more information on that.
Well, I believe you have to deal with your hospital because did you ask about IRB?
Yeah, he asked about.
Yeah, I was wondering if you're working with the patient, like in our cases, do you still for every stage we need that, or just for the certain stages we need that?
Yeah, well, there are two things. One is that if you are doing research, then you need IRB. If you are not doing research, as a professional, as a physician, as a respiratory therapist, the HIPAA thing is that important, but not necessarily IRB.
Thanks.
Okay, Dr. Beeson, please.
Yeah, it seems obvious that one of the goals is to reduce the sequelae of the comorbidities that these individuals have and to improve health. Mm-hmm. It's generally understood that it's cheaper to keep a person well than to make them well once they're sick. Mm-hmm. But it's my understanding that currently the participants have to pay out of pocket. So what do you think needs to be done in terms of evidence to try to convince the insurance companies and maybe even Medicare that this is worth reimbursing the people and paying for it to, in other words, keep the people well, even though they have a morbidity or one or two morbidities to get into the program. But if they can reduce the sequelae, obviously the insurance companies are going to pay less for pharmacology and other things that try to get them well once they already are sick. So as far as evidence-based medicine, what do you think you need to do, or maybe ITLC in general needs to do, to create enough evidence so that the insurance companies will pick this up rather than out of pocket?
Mm-hmm. That's a great question. I think it's going to rely on the professionals, the doctors, the healthcare team that we're working with, and then further support spreading this type of program to. We're the only university that we know of that has the ITLC program. So spreading it maybe to other universities or spreading it to other hospitals to kind of incorporate this shift in, instead of reactive care, we're preventive care. So we want to start that idea through either the healthcare professionals, the doctors, encouraging other universities to pick this kind of program up. ITLC also has, I believe, other avenues of programs that are kind of similar to this, where it's with the workforce for the Loma Linda workforce, and they're trying to start that up. So if we start integrating these preventive care, I guess, protocols and these programs into these commonplace situations, I think that would show the benefits, the cost benefits, especially at the workplace, where you're seeing individuals, their quality of life improves. There's less sick days being taken out of their work time, or they're more encouraged at work, and just even interacting simply with employees and bosses on a higher level, their work efficiency improves. So if we start those little seeds in different areas of our lifestyle, work being one of the most important, since America's so obsessed with work, maybe that would be a great place to start and show that these insurance companies, you should be supporting these programs, and even incentivizing some of the programs either at universities, workplaces, hospitals, wherever, so that the participants even feel more engaged, setting up groups, exercise groups within these, and then maybe in the workplace, setting up an exercise group, sending out, giving them coupons for gyms or things like that, or coupons for grocery stores. Where can you get your healthy food easy? Come to this grocery store. Creating those loops of information and resources. Hopefully that could help improve the situation with insurance, seeing that it's an investment in people and not just, waiting until they get sick.
Yeah, good response. But I think it would be a long road to hoe, if you will, since it is out of pocket, to convince other hospitals and other healthcare institutions to pick up this program when people are, have to pay out of pocket to go through this program, even though it's going to improve their health.
Mm-hmm.
It might be a long road, but I think it's certainly worth it.
Mm-hmm. I agree.
Yeah, one point that we are making here is for our preventive care specialists, when they get the health coach certificate, they are helping us. Jonquile is to the ITLC, but mostly voluntarily. But we are kind of waiting to the day that if one preventive care student has the health coaching certificate and sit for the exam, they can be reimbursed, because the American Medical Association is working to provide CPTs or codes to reimburse health coach, specialists to work in the system, and then the other. As soon as Medicare buys the idea, the other insurance companies will follow through, and then we expect that because one of the secrets of this intensive lifestyle, what they call therapeutic lifestyle change, is the health coach, because they can stay with the client a little closer, a little enabling them to their level. And we wanna be reimbursed for that, and that's it is being working on that.
Mm-hmm. That's a great point.
Okay, guys, I think it's 101. Thank you, Jonquile. It was excellent. Thank you, Durugbo too. And then we will finish now. If you have any questions, you can email to us. And then thank you for your attendance. We have 10 people today. That was good. Bye-bye to all.
Thank you, sir.